All right, we're all set. Hello, everyone. I'm Adam Livingston, PharmD.
Hi, I'm Dr. Yusuf Siddiqui. I'm a naturopathic doctor here at NutriChem.
All right, and this week, Men's Health Week, we're talking testosterone, the big T. All right, so
Yeah,
um, let's just I just wanted to start actually with just your own take and just your basic rundown on testosterone, how it's made, and just sort of the basic principles, Yusuf.
yeah. As like one of the few male naturopaths in Ottawa, I have a fairly large male population and a strong focus on men's health. And a lot of guys actually don't even know where testosterone comes from or what the process is. We talk a lot about female sex hormones, but male sex hormones kind of have a similar pathway, a little bit more simpler. There's a signal in the brain. There's two parts of the brain, but there's a signal that comes in that stimulates the anterior pituitary, kind of in this part of your brain, to release luteinizing hormone and follicular stimulating hormone, and they go down to your gonads, to your testicles. And luteinizing hormone in particular stimulates what are called the Leydig cells in your gonads to actually start producing testosterone. And then from there, testosterone goes through a couple of iterations in the body. When we do a lot of blood work, we look at free testosterone. Free testosterone isn't bound to any proteins. But what it does is it works on the tissue level. So it works on like your seminal vesicles, bone, your muscles, prostate. And then at a cellular level, testosterone will convert into something called DHT, which is a very bioactive form of testosterone. It's responsible in a fetus for the development of our genitals. It's responsible for gonad development. And then it's also it's impacted by something called 5-alpha reductase, which a lot of you may have heard of when we're talking about prostate health and whatnot. So testosterone comes from your gonads through Leydig cells. There's a connection, a feedback loop that happens when there's ample amounts of testosterone or not enough testosterone or too much testosterone.
Mm-hmm.
Yeah.
Yeah, and testosterone in the last few years for men, I mean, you work a lot with bioidentical hormones for women, but in the last few years, there's been a lot more focus on menopause and aging men and hypogonadism as men age. And it's true, as men reach about 50 years old or so, their testosterone naturally starts to dip. And we've seen more and more men coming into the pharmacy that have heard about testosterone replacement. And they kind of come in with their list, which we can talk about more, of signs and symptoms of low testosterone. Right. And they say, I have a bunch of these on this list. I must have low testosterone. I want to do testosterone replacement. How can I come into the clinic and get it prescribed? And it's like, whoa, hold your horses. Like, it's not just because you might have low T or have some of those symptoms doesn't mean that the answer is just to actually replace testosterone directly. There's a lot of natural ways you can boost your testosterone. And for a lot of men, I like that you mentioned free testosterone versus total testosterone in your intro there, because there's a big difference. And a lot of these men might actually be making enough total testosterone, but the issue might be free testosterone. Do you want to kind of elaborate on what the difference would be and how that would impact things?
Yeah, and so when we look at free testosterone, that's what's actually bioavailable. Your body actually, our tissues use it, and we associate that a lot with like spermatogenesis, so the amount of sperm and semen that we're producing as men. Free testosterone has an effect on like muscle gain. So when we're looking at low levels of testosterone, like some guys will come in, I'm not putting on muscle mass, my libido is a bit lower. What are other signs? Fatigue, depression. Patients wouldn't be coming in noticing that they're experiencing bone loss, but maybe they're getting a little bit shorter. That could be another symptom of it.
Mm-hmm. Libido, ED.
Yeah, of course. Yeah, erectile dysfunction and libido. Testosterone from a traditional Chinese medicine perspective is this very yang hormone in our body. And it's responsible for a lot of things. But what's interesting, which you were talking about, which I see a lot in my practice, there are a lot of guys, because I do like the men's health shtick at NutriChem. Look, a lot of guys will come in, maybe they're sent in from you, I'm not sure, Adam, but they're like, my testosterone is low, what do I do? And we do these comprehensive panels, and when I go through it with them, I'm like, actually your testosterone is fine. It's completely normal. There's nothing wrong with your testosterone. There's actually, a thyroid imbalance, or their cortisol levels, which is produced by their adrenal gland, is so high. They're so stressed. They're burning the candle at both ends, and this high cortisol production is decreasing the production of testosterone, which then becomes a contributing factor to all of these symptoms that they're coming in to be treated. So, I know that on other things that I talked about through NutriChem or other kind of public speaking things, I talk a lot about in men's health that, guys, we're more than just our testosterone. I know testosterone is going to be kind of the point to get your interest, but I hope that like at the end of this, or if you see a naturopath, you'll understand that your health is beyond just testosterone. But don't get me wrong, testosterone does play a huge role in our health. I know we were talking a minute ago, Adam, about oh my god, I can't remember his name. The Jeff Rogan.
Oh yeah, Joe Rogan. Yeah,
Joe Rogan. Why did I think?
Well, yeah, like a lot of
my day.
Joe Rogan, like it's a huge podcast, so we have lots of guys, and he's sort of normalized it or made it trendy because he's been using testosterone replacement. I think there's a lot of men that would actually benefit from using testosterone replacement, but there's also a lot of times where there's more nuance to it than that, and there's a lot you can do for your own testosterone production. Like some of these men are in their 30s and 40s, and they're like, oh, I'm getting low T, it's already starting to decline. And, they don't sleep, which is probably one of the biggest things. Their cortisol's through the roof. So if your cortisol is really high, you have this protein called sex hormone binding globulin. It binds up all that testosterone, and then it's not free to go hit the cellular targets to make you make more muscle, to increase your libido. So you really kind of, I've said this before, but you kind of have to have all your ducks in a row health-wise to have good free testosterone levels and get all those benefits. You need to sleep, you need to be eating well. If you're eating tons of inflammatory foods, that jacks up cortisol and all these inflammatory cascades, which again will shoot all your free testosterone. Cortisol is the testosterone killer, probably one of the biggest ones.
The biggest one, for 100%. That's when like herbs like ashwagandha, which is, it's an evergreen shrub that's found in India and the Middle East. And it's one of my favorite herbs when we're looking at balancing that kind of HPA axis. So we're looking at the adrenal testes axis. Specifically what it does is it helps to modulate the cortisol production, like you were talking about, Adam, but it also helps to bring down the cortisol, but also increase the amount of DHEA. And DHEA, which is predominantly made by your adrenal gland, is a big contributor to the production of testosterone. It's needed for testosterone to be made. So in that sense, ashwagandha plays a really, really significant role in it. And then, there's a ton of research and studies that look at like that ashwagandha increases sperm motility, sperm count. There's a lot of benefits with ashwagandha. Helps with sleep.
Yeah, it's probably, of all the herbs, it's probably one of the best ones in terms of having pretty good little, small, but still pretty good quality randomized controlled, placebo-controlled trials showing, reduction in cortisol, increase in free testosterone pretty consistently. So I'm a big proponent of ashwagandha.
Yeah.
Another mineral we were talking about that's big for testosterone production. I think of it as the most anabolic of the minerals if guys are looking to put on some muscle because of this connection to testosterone production is zinc. Zinc is probably sort of the classic. If you've heard of like ZMA, zinc, magnesium, and aspartate, that was one of the earliest sort of muscle building supplements that was around, 30, 40 years ago.
And two important things on that is with zinc, the dosing can get quite high. So the research is like 30, 40 milligrams every day, but you also have to be careful when you're looking at your supplement to make sure there's a bit of copper, because when you're actually prescribing or taking that much zinc, it will deplete your copper levels, and then some other things will start to kick in. And then the other one that you just mentioned, the ZMAs, the acid.
Oh yeah, aspartic acid.
Aspartate, yeah. So we were talking about this a minute ago too, and how the evidence for that's controversial. And so in the sense that there was like a study that came out that said guys who took 3 grams a day, that it increased the production of luteinizing hormone, that signal that comes from your brain and stimulates your gonads to produce testosterone, that it increased the amount of LH. So then testosterone levels went up. And boom, there's a benefit there. However, there's a lot of conflicting evidence and research that's out there. There was even a study that I looked at that looked at higher dosing, up to 6 grams, and that actually had a negative effect on testosterone. So you have to be really careful about what it is you're taking if you're self-prescribing.
Mm-hmm. Okay. Yeah, like when I think of ZMA, I find aspartate, I haven't seen it work really well, but also the studies are so conflicting.
Right.
I always thought of it as zinc, which we know is probably the most anabolic mineral, magnesium, which is so good for general health anyway, and then ashwagandha. That's how I think of ZMA. I don't love the aspartate just because I don't think it's super effective, but yeah, that would be my trio of natural. My natural trio for testosterone would probably be those three is sort of the foundation.
Yeah, and I'd even throw a little vitamin D in there, in light of what's going on in the world, and as part of our standardized testing, blood work, we do vitamin D is included in the panel. And in light of even Health Canada coming out and saying that the recommended daily dose of vitamin D is increased from 1,000 to now 2,500. Everyone is deficient. It's so fascinating.
Well, especially in Canada, right?
Right, and I think people think that if they're going to walk around with their in the sun for an hour a day, they're going to build ample amounts of vitamin D in their body. But the reality is, the way that the sun rays hit our skin, our body's not able to convert it as effectively as if we were, on a nice beach in the Caribbean, soaking it up. But what's interesting with vitamin D and testosterone is that there was a year-long study where men took 3,300 international units of vitamin D daily, and they tracked their testosterone, their free testosterone, and there was a 20% improvement just by normalizing vitamin D levels. The one thing in that study, though, that they didn't mention was were they vitamin D deficient or not. But I know in my practice, I'd say like 80% of my patients have suboptimal vitamin D, if not very low. So I would even throw that into the mix. Now 4.
And we came up with our product. We call it Deep Calm Essentials, but it's essentially like, in my opinion, it's the more legit version of ZMA, which is zinc, magnesium, ashwagandha. But we included vitamin D, and then we also included things like GABA, which is your natural inhibitory neurotransmitter, which can help lower cortisol. We also threw in a lot of cortisol lowering agents in there too, and that's kind of the idea behind ZMA, ashwagandha. It lowers cortisol, can get you into a deeper sleep. You can make more free testosterone.
Yeah, which is great. And then, with that combination product, what's really interesting is men who have lower testosterone, or they're starting to move into that symptomatic zone. One of the key things that they experience is a lack of morning erections. And across the board, when I prescribe this to my patients, that's I say, watch out, you're going to start developing these, your morning wood, and boom, they come in, they're like, you're not going to guess what happened. I'm like, great.
That's good. It's a nice, clear indicator. That's good.
Right. It's actually pretty interesting. There's another thing that's interesting when we're looking at the complexities. I know we're focused really on testosterone, but it's important, and cortisol, but we also need to look at things like aromatase. So we look at individuals who are coming, with COVID, we've all put on, what is that, COVID-10 evolving into COVID-20. And so we look at adipose tissue or fat cells, and testosterone can be converted into estrogen through something called aromatase, which is found in fat cells. So another thing to notice is the balance between testosterone and estrogen in men. And it doesn't mean that if your estrogen levels are getting high, that you're going to start developing female characteristics or gynecomastia. That isn't always the case. But when I work with my patients and we're working on weight loss, so someone's there, we're working on gut health, which inevitably results in weight loss. It was interesting if some guys were saying that they were noticing that I had this one guy, he had this great way of describing. He said, it was in his intake form. He's like, I feel like my penis is retracting into my body. And I had no idea what that meant. I was like, that's like really interesting, like retracting into my body. What does that mean? So when I met with this guy, he's like, I feel like it's actually being pulled in. And so then we ran some blood work, and it was exactly that. His testosterone was shunting into estrogen, which was resulting in like essentially shrinkage of his penis. And it was fascinating. So I'm like, oh, okay. So we need to add in we need to start metabolizing this estrogen out of your system. So A, you're getting rid of it, and B, your libido and everything else starts to improve too.
Mm-hmm.
So it's
That's another
interesting.
thing. You also see that with, the other side of it, which isn't something we get into. When we deal with testosterone replacement therapy. So let's say we try all the natural stuff, doesn't quite cut it. They've done the lifestyle, they've improved their diet, they're sleeping, their testosterone's still low, or their free testosterone's still low. Now we need to move to, say, testosterone replacement, which you currently can't prescribe. And as a pharmacist, I can't prescribe. I work with it a lot. We do dispense it and compound it, but we work more with our nurse practitioners when they prescribe that with us. But typically it'll be anywhere from like 25 to 100 milligrams a day transdermal, or if they're injecting, it might be about 50 to 100 milligrams of a slow release testosterone enanthate or cypionate a week. So quite low dosing. When you see guys that are sort of abusing testosterone in the bodybuilding sort of illegal use of testosterone world, you're talking like 500 milligrams up to a gram of test a day, or equivalent with a synthetic like D-ball or any of those.
Right.
Which, when you mentioned the aromatase and the conversion to estrogens, that's a big factor. Like, more isn't necessarily better. And that's why these guys have to cycle their steroids. They have to use estrogen blockers, and they have to account for the fact that a lot of that testosterone is going to get converted to estrogens, which will have the opposite effect of what they want, and way more risks, right? Like, again, this is why you want to do this medically under supervision, where they're doing blood work, because sky high testosterone isn't necessarily more is better. It can cause a lot of problems cardiovascular wise, hard on the liver, hard on the prostate. You mentioned conversion into DHT. That's a big issue.
Right.
So there are safety issues with testosterone for sure. A lot of that's mitigated by just dosing safely and reasonably and testing, every 3 months or so. But that's something to keep in mind. A lot of these men come in and they're all amped up. I want testosterone, more is better. And it's like, no, it's a fine balance. It really is.
Yeah.
If you just take huge amounts of testosterone, it'll be great for a while. But if you didn't cycle it properly, for example, you're going to end up losing all those muscle gains and actually developing possibly some more female characteristics. So your body's always in this balancing act, right? So more
100%.
testosterone isn't just better.
Yeah, and I think the important message here with that is that the human body is this kind of web of all these different systems that talk to each other. And I mean, Adam, you hear about this. I get guys booking into my practice who are looking to increase their testosterone. And I think what's important is that when you look at your own health, you have to look at it as like an intricate web. You're not just your testosterone. So although guys want to get jacked and muscular and lean out and increase their mood and libido and all of these types of things, there are other compounding factors that play a huge role that need to be discussed and ruled out before we even start looking at testosterone. Things like diabetes, weight loss, cardiovascular function, tons of things.
And you mentioned a great point. Like, those are some of the biggest sort of contraindications, or sort of
right,
red flags of like, let's try some other things first. If someone's really, like, if a man's really overweight, testosterone's not the best idea, because a lot of that will get converted into estrogens and can be cardiovascular.
I would even argue you don't even have to be very overweight. Your BMI could just be on the high normal side as well. Although I don't like BMI, but just on the high normal side. Yeah, I think is an important thing. So yeah, I think the message is that, there are solutions to building testosterone, both from a TRT and from like a naturopathic standpoint. Unfortunately, at this point in time, it falls outside of my scope. One day it'll be great if it falls into it. But as Adam had mentioned, we both have access to our nurse practitioner, Jamie, who has the ability to prescribe testosterone. However, there have been people who booked in for it and people who she's turned away, and enough who said, she doesn't think that they're a good candidate because there are a whack of other things going on in that individual's body, and a more thorough assessment needs to be done to decrease all the other factors that could be contributing to some of the symptoms they're experiencing.
Yeah, and that might be a little disappointing to the guys that have already
Yeah,
decided I want TRT, but it's
yeah,
also hopeful in that like no, you don't even need it. Like you can make your own testosterone. There's lots of stuff you can do. And it's amazing how many of these guys like their life is kind of crazy. Like they maybe work a super demanding job, they don't sleep, they're using alcohol for anxiety all the time. They're full of cortisol, and it's like
100%.
that lifestyle overhaul. Like you can get all those things you're thinking in your head of TRT without having to use TRT. It is, it's not as easy as just applying a gel, but you'll be way better off for it. And that's what our nurse practitioner often concludes of like, look, I know you came looking for TRT, but like you'll be much better for it in the long run to do it the way we're doing it. Because you're
Exactly.
going to get all your pillars of health in a row, and it won't be just your testosterone that improves, it'll be everything that improves. So
Exactly. Could you imagine you come in for testosterone and you leave with like great gut function, your
yep.
metabolism is better, thyroid is balanced, your mood is lifted and you're feeling great, and your testosterone is optimized, even though that was like an added benefit to the overall treatment.
Yeah, absolutely.
So,
And that's the NutriChem sort of holistic approach. So, yeah, I love
yeah,
it.
it's great.
Great. All right. Well, thanks so much. This was good info, I think, for a lot of men. Feel free to drop by NutriChem and we can chat in the dispensary, or if you'd like to book with Yusuf to talk more, that's open as well.
Perfect. Yeah. And our patient coordinators at the clinic will be more than happy to answer any questions. I'm sure you can find their information on our website or on this Facebook thing. And Adam, thank you. That was fun, as
Thanks,
usual.
Yusuf. Thanks so much.
Okay, great.
Bye, guys.
Thanks.